Let's take a look at section 4 of chapter 28, which is going to begin our male reproductive system. So we spent a long time on female reproductive system, which is understandably, it's very complicated with the ovarian cycle and the uterine cycle. Male reproductive system, not so complicated, so that's the good thing. So let's take a look at the different reproductive organs. So you have your primary reproductive organs of the male reproductive system, and this is going to be the organ that actually is going to secrete or produce those gametes and also secrete the hormones. And those are going to be the testes. And then you're going to have all of the accessory reproductive organs, which are mainly going to be the ducts that are going to run throughout. So you have the ducts and tubules that lead all the way from the testes to the penis, but it also is going to include the glands that contribute to semen, and also, of course, the penis, which is going to be the copulatory organ of the male reproductive system. So let's start off with the scrotum. The scrotum is, of course, going to be the skin-covered sacs down between the thighs here, and this is where those testes are actually going to be housed. So you can see them right down here. What they do is they are going to allow the testes to sit outside of the body. And the reason why we need this is because inside of those testes is going to be where the gametes are. And remember, gametes are going to be sperm. So sperm actually need to have their environment about 3 degrees Celsius cooler than the internal environment. So that's why they are going to sit outside of the body to make it cooler that way. And that's going to allow the sperm to develop and allow it to mature. If they don't sit outside the body like that, if for some reason the testicles for some reason retract inside back into the abdominal pelvic cavity, then that male is basically going to be infertile because the sperm are not going to develop at that warmer temperature. Remember, the scrotum is that homologue to the labia majora. So in the very last section, we'll take a look at this embryonic tissue that all of these homologues are developing from. So let's take a look at the scrotal wall. You have a layer of smooth muscle. You can see in here. You are also going to have this thing called the dartos muscle. You can barely see it even if I pointed to it. It needs to be a little bit bigger, but it's going to be a muscle that's going to be in that wall right there. And you also are going to have some fascia in there as well. So we'll talk about how the dartos muscle, along with this cremaster muscle, are going to be responsible for the movement of the scrotum up and down, so superiorly and inferiorly, in order to keep that environment the way that it needs to be. And the spermatic cord, we'll take a look at that here as well. So the spermatic cord is going to be the structure that is going to run, that basically starts there at the inguinal canal, and it's going to run all the way to the testes. So these are the layers of the spermatic cord wall right here. So if you take a look at it, it's mainly a couple of layers of fascia, and it's also going to be something called the cremaster muscle as well. So you might remember the cremaster reflex from 2401. You might not. Some instructors don't cover it. Some, or even, it's not really about the instructor, but the book doesn't cover it. But the cremaster reflex is where if a male is gently stroked on the inner thigh or anywhere around the genital region, then typically the scrotum is going to contract, or actually the cremaster muscle is going to contract and is going to pull the testes almost up inside of the pelvic cavity there, and that's the cremaster reflex there. So it's going in and pulling it closer. And again, we will take a look at the cremaster muscle and the dartos muscle later on whenever we look at temperature control. Another thing that the dartos muscle does is going to give rise to that characteristic kind of wrinkling effect of the scrotum as well. So taking a look at the structures that are actually in the spermatic cord, again, the inguinal canal is going to be this hole right in here that these ligaments and these vessels are going to actually pass through, and that's where that spermatic cord is going to start. So what we have in here is going to be part of the duct network, which is going to be the ductus deferens. It's that white structure that is found in here. You can barely see it on that inferior end, but you can see it more on the superior end. But you are also going to have blood vessels. We'll talk about how they're important here in a second. Testicular artery and vein. But you're also going to have this thing called a pampiniform plexus. And what this is it is going to be this venous network. So you can see it. There's the word right here. So what the pampiniform plexus is, it's going to be this network of vessels that is pre-cooled. The blood is actually pre-cooled. So by the time it gets to the testes, the blood that's reaching the testes isn't warm, and it's not going to go in and, of course, destroy our sperm. So it is going to be really important to make sure that we pre-cool it, and that's the responsibility of that there. So let's take a look at how the scrotum responds to temperature changes. So say you have elevated temperatures. Maybe your males are exercising or something like that. Body temperature elevates. And what happens is that the testicles will tend to try to move further away from the body. And the way that it does that is those two muscles, the dartos muscle is going to relax and the cremaster muscle is going to relax as well. So you are going to have that's going to allow the testes, the scrotum, which is going to allow the testes to actually move inferiorly away from the body. And what it's doing is it's trying to get away from that elevated temperature so the sperm don't fry up, which would not be good. So say that you are going to be exposed to decreased temperatures. Maybe you jumped into a pool, a really cold pool, and what that does is, of course, if you jump into a cold pool, then your scrotum and your testicles are going to feel that coldness. And what it's going to want to do is they're going to want to go inside where it's a little bit warmer. So what happens is that the dartos and cremaster muscle are going to contract. And when that happens, it is going to pull the testes and scrotum closer to the body, and that is going to help conserve that heat and make sure that the sperms stay at the temperature they need to stay at.